Hey everyone, this is Tumblr Transits. I'm Jonathan, and the topic this week is health while transitioning. I'm going to cover 5 main points. They are mental health, Pap Smears, binding, testosterone, and surgeries. Mental health is probably, in my opinion, the most important. Transitioning from one gender to another is a major change, and it can be very difficult mentally, as I'm sure many of you know or can imagine, at least. It is very important that you have someone you can speak to, preferably a therapist that has some experience with transgender people. If that isn't an option for you, uh, you can't find a therapist that has had such experience. Any therapist, mostly any therapist, will be willing to learn about transgenderness if you're willing to teach them. If you can't afford a therapist, there are some that have sliding scales and um, try to become affordable. If it's still not affordable for you, you should just try and find a friend that you can really talk to about all of this stuff, a friend or a family member, or go on and on anonymous on Tumblr and just message someone that's willing to read your thoughts. Um, if you have any underlying mental health issues, testosterone can make them worse, especially depression. So it's very important that you have any mental health issues under control before transitioning, especially medically transitioning if you choose to do so. My second point was Pap smears. Any people with vaginas that are sexually active and or older than 20, I think, I'm not sure exactly how old, but it's probably around there, should be having regular Pap smears done. Um, Especially if you're taking testosterone, because that can cause, or it is thought that it might be a possible cause of cervical cancer. Um, so if you haven't had a hysterectomy, you need to be having your Pap smears done. Um, if you don't have a doctor, you can find a free clinic or Planned Parenthood. The doctors and nurses at Planned Parenthood are supposed to be trained in helping trans people specifically, so they should be willing to help you. Binding. Everyone has talked about this. All binding is dangerous. Um, Binding with ace bandages is even worse. It's probably the worst. Actually, duct tape is probably the worst, but I don't think most people do that. Mostly anyone. So binding, do it as little as possible. Use a proper binder. If you cannot afford one, find a program that will help you. I run a program on Tumblr called Binder Finder that matches people with binders, and we take donations so that we can subsidize people's costs. And there are other programs that have existed far longer that already have enough money to just give everyone that needs one a free binder. Testosterone. Take your proper dosage. Don't overdose. It's not going to help you, and it's quite possibly going to hurt you. Get your lab work done. It's important to know all sorts of factors that other people have already talked about, um, especially cholesterol. And if you have a history, either yours or someone in your family, of having high cholesterol, you definitely need to be watching that. And my last point is about surgeries. When the surgeon and his or her staff are explaining um, aftercare, like post-surgical care, you need to pay attention and listen to them, take notes probably, and then when it comes time, do it properly. And make sure you understand what you are supposed to look like so that you know if you need to go in to a doctor to get something checked out. That goes for testosterone too. Make sure you understand what to expect so that if something that you're like, oh, I don't know, is this normal? Does every trans guy experience this? You should know what's normal and what's not normal, so when something not normal happens, you tell your doctor about it. So those are my main points for health while transitioning, specifically from female to male. And that's it for this week on Tumblr Transits. Well, for Thursday. I'll see you all next Thursday. Bye.